my name is Spencer, and I'm going to be your nurse today. Would you mind verifying your name and date of birth for me?
Zachary Allen, January 25th, 1997.
Okay, perfect. So today I'm going to be doing a lungs and respiratory assessment. So just by looking at you, I can tell that you're not having any difficulty breathing. You're not sitting in a position where you have to make it easier for you to breathe, so that's a good sign. Your skin color looks good. Your lips and your fingers are a good color. If I check this pulse ox, you're 99%, which is almost perfect, so that's great. So the first thing I'm going to do is I'm going to start on the back. I'm going to identify some regions. So here down the middle of your back is your vertebral line, and this marks the inside edge of your lungs on both sides. And then going down the middle of your scapula is your scapular line, and this marks the outside edge of your lungs on both sides. So now what I'm going to do is I'm going to put my hands on your back, and I'm going to check for size and symmetry and any deformities on your back to see if everything is looking good. Perfect. Now I did want to mention that your lungs actually go up higher than you would think, so they actually start this notch on your neck right here. This is your C7, and that is where the apex or the top of your lungs are, and then they actually extend down to your T10, and so that's where the base of your lungs are. And I'm going to be listening for a few different breath sounds. So near the center of your back are going to be your bronchovesicular sounds, and then in the space around your scapula, those are going to be vesicular sounds, so that's what I'm going to be listening for. Okay, so every time I move my stethoscope, if you'll just take a breath in for me. Okay, perfect. Everything sounds good back there. So now I'm going to move on to the front. I'm going to identify some landmarks, okay? So right here in the middle is your sternal line. This marks the inside edge of your lungs. And then we have the midclavicular line, which marks the middle of the lungs. And then we have the axillary line, which marks the edges of the lungs. Now the apex of your lungs in the front is actually about 2 to 3 centimeters above your clavicle, so it starts about here and it goes down to about your 6th rib. And that is on both sides. And then this space right here where your ribs meet in the center, right where it meets on this bone, is called your costal angle. And so that marks the shape of the lungs as well. So now I am going to check for deformities and symmetry and shape of your lung region. I'm going to put my hands right here. You can take a deep breath in for me. Everything's moving symmetrical and everything seems normal, so that is perfect. Now I'm going to listen to your lungs in the front. Okay, so every time I move my stethoscope, if you'll take a deep breath in. Okay, perfect. Now what I'm listening for in the front are those same bronchovesicular sounds near the center where your sternal line is, and then the vesicular sounds are going to be in the middle of the lungs at each of your lobes. You also have sounds called bronchial sounds, which are more up in your throat, which is a different kind of sound than those other two that I just mentioned. So do you have any questions?
No.
Okay. I will let your doctor know that everything looks good. Are you comfortable?
Mm-hmm.
Okay, here is your call white for you, and the doctor will be in soon.
Thank you.
You're welcome.